welcome to my channel again. Today I have this 4-month post update. So let me just tell you guys what kind of surgery I had. And this type of surgery I had was upper jaw surgery, which was my they did work on my upper jaw. They didn't do work on my lower jaw. However, they did do that sliding genioplasty. So they did work on my lower jaw, but not like the full lower jaw. The only procedure they did was the sliding genioplasty for my lower jaw. So yeah, that's that. So that's the quick recap. And since my last update, which I did, my 2-month update, I know I've talked about going on my third visit to my surgeon, or not really my third visit, but it was my 3-month update, which was an office visit I had with him, and that was on my 3 months. That was a month ago, and that's the last time I saw him. I haven't seen him since then. Next time I will see him, it's on my 6-month update, so that's coming along in like 2 more months. As I've told you guys in the past videos, my surgeon did an excellent job on this surgery. Everything went great. Everything is healing great. I'm very, very grateful to have done this surgery with him. And his name is Dr. Abid. He works at the MedStar Washington Hospital here in Washington DC. And yeah, I'm gonna give you guys like an info box. In the info box I'm gonna put the links to his website or wherever you guys can contact him if you guys live around the DC area. So yeah, he's really great. I really recommend his office. Like, all the people that work in his office are amazing. The one thing that I had to ask that day to my surgeon was about my opening of the jaw. Why should I be opening already my jaw? So he said you should be able to fit up to 3 fingers in your jaw, like, you know, when you open your mouth. So I was very concerned about that because I couldn't even fit 2 fingers. And just the surgeon was like, you know what, just practice every day at home and this will get better. So he just said, you know what, just practice every day at home. And that's what I've been doing. I can fit 2 fingers. I'll show you guys a little bit later, but I can fit 2 fingers, up to 2 fingers and a little bit more. I've been practicing a lot since then. And it's been a month since my visit, so I've been practicing a lot. And hopefully in like my 6-month visit, I will be able to fit up to 3 fingers. And it's kind of hard. That day he basically like forced my jaw to open really wide, and it was really, it didn't hurt, but it was kind of like a little, I don't know. I was so scared to open my jaw big, so I think that's why I was just like, but he said to start exercising on that, and that's what I've been doing. So then that same day he also checked how my stitches were healing. Well, I don't have any stitches anymore, they are gone. And he just checked how like the inside of my mouth is healing, and it's healing really good. I mean, I can tell when I pull it apart, not pull it apart, but I can tell when I like open my mouth and how it's healing and everything. So he just checked that with his fingers. He like touched inside and he was like, yeah, it's going great, you look amazing. And he just asked me how I felt, and I just told him I really feel good. Like, I feel really good, especially because that fixed my breathing problem. I'm really grateful that my insurance was able to pay for this because it was a health issue surgery. So I'm really, really grateful my insurance paid most of it. So then he just gave me a 6-month appointment, and there I was gone. I got so sad because he said I was going to only see him 2 more times, which is really sad because he said 6 months and then 1 year, and after that, you know, if anything happens to you or you need like to go and see him for something, then, you know, you can get an appointment. But other than that, you don't need to get an appointment. He said you're good to go. And I was so sad because I'm like, I'm just gonna see them 2 more times, and I'm like so sad, but it is what it is. So my next topic is my numbness. And regarding my numbness, I still have some numbness in my lower lip, and also I have my upper gums and teeth still numb. My lower lip has been coming back little by little. I can tell, like, whenever I touch with my upper lip, and I can tell, but I know it's not fully recovered yet, and my nerves are still sleeping. I think they're taking their time. So what I'm gonna be doing next is eating some hot spicy foods, because that's what I heard that wakes up your nerves. So yeah, I'm gonna be doing that. I don't eat spicy foods, but I'm gonna try and eat spicy foods. And also I heard cinnamon wakes up your nerves, so I'm gonna be eating those two things to help my nerves wake up. And yeah, like I said, it's still kind of numb, and then whenever I apply lipstick, I feel like tingling sensation. So I mean, you can tell when you touch it, but you can't really, I don't have the full feeling back yet. So yeah, that's that. And then my upper lip, it's totally fine. Nothing happened to that. It's like normal. Just my what's it called? My my gums and my teeth are still numb. My gums in this lower area, on my genioplasty area, it's still a little bit numb, but they're coming back little by little. So that's that. It's 4 months and I still have numbness, but the good thing is that my face is normal. It's back to normal again. And yeah, I don't have to worry about having a puffy face anymore. Maybe inside a little bit, but I don't see it whenever I see myself in the mirror. So I'm good. I'm good in that aspect. One thing about my face is that on the areas that I have, or I can feel the screws on, I still feel a little bit stiffness in that area. And yeah, I guess that's normal. I still feel a little stiffness. However, on the lower areas, like, I can feel the screws here, but I don't feel stiffness at all. That's something I wanted to mention, that I still do feel stiffness a little bit right here. So next, I want to talk about eating. My third visit to my surgeon, he said I can go back to normal chewing, so that's good. I've been chewing meat. I've been chewing like other things other than rice and mashed potatoes, so that's really good. He also said I can go back to normal physical activity, which is really good. One thing I want to mention was also that I went to visit my orthodontist after the 2-month post-op. And oh yeah, I didn't tell you guys. Oh my gosh, how could I didn't tell you guys, but after the 2 months post-op, I went to my orthodontist, and she took off my surgical hooks off, and I'm so happy I don't have any more surgical hooks. I'm so happy. She took it off like 2 months and a week. I was so happy to have taken out the surgical hooks, because it was bothering my lip area inside my mouth, so I was just so done with that. And I was so happy I don't have it anymore. I don't have to deal with that anymore. So yeah, that's good. My next appointment with my orthodontist will be February 13th. And that's when she will basically tell me how many more months I have left with my braces. So far, my last visit, when she took off the surgical hooks, she just took off the surgical hooks. And I still have the rubber bands on the same areas that she had me last time. So she just said, let's wait a few more months until you heal a little bit more. So that's already coming up. So yeah, I'm gonna go back to see her next week, and she will let me know how many more months I have left with braces. And then she'll also probably tell me like where to change my rubber bands, or how to change it and everything like that. One last thing I want to talk about was insurance. I know some of you, like 1 or 2 people, asked me about the insurance issue, like how the insurance, or if the insurance was able to pay for my sliding genioplasty and the yeah, I think that was it. So basically, I just want to let you guys know, yes, the insurance did pay for it, and also it paid for, like I said, it paid most of my surgery. So basically with my insurance, this is how it went. So before my surgery, I knew that I had an $800 deductible on my insurance, and also a max out of pocket before they pay the 100% of the billing and everything like that. I had a max out of pocket of $2,800. So it was around, like, no, I think it was $2,400. I don't remember quite well, but it was over 2,000 and under 3,000. So basically that made it a little bit worth like almost 4K that I had to pay out of pocket. The day of surgery, I paid upfront out of pocket $1,600. So that covered some of it, so that's really good. And then right now through my insurance, I'm paying the anesthesia and also some of the office visits that I had. Well, I had a lot of office visits, so I'm paying that. That's almost like $800 something. So that's like the deductible covered for sure. And yeah, that's basically it. I didn't have to pay a lot. And I'm so grateful for that again, because after the max out of pocket, the insurance pays 100% of everything. I'm so happy. I'm so happy because they are such a great insurance, and yeah, I'm just very grateful with the insurance. Just to end this video, I know every time I do this video, I show you guys my side profile, left and right, so I'll do that right now. This is how it looks in the front, and this is how much I can smile right now. I don't show my gums like I used to do. And my side profile. That's my left, and we're gonna do right. Oh, and then I wanted to show you guys how many fingers I can basically fit into my mouth area. And I've been practicing, I've been doing this every day. So yeah, that is it. I hope you guys have a great day. If you guys have any questions about the surgery or anything, just let me know in the comments below, and I'll answer that in my next video, or I'll answer it in a comment to you guys. And yeah, thank you guys for watching. Thank you guys for being here every update I do. And yeah, I'll see you guys in my next update, which will be the 5-month update. Okay, thank you, bye bye.